I work at the Ohio State Wexner Medical Center in an acute inpatient rehab facility called Dodd Hall. We use assessments and treatments to improve someone's independence and their daily living skills. So this can be anyone with a mental, cognitive, physical impairment. And it can be simple things like getting dressed and grooming and bathing to higher level things like being in the kitchen and cooking or medicine management, money management. Anything that you have to do in your daily life, we get you back to doing as independently as possible. So I've been at the medical center for about 3 years. I've been an occupational therapist for a total of over 5 years now. The difference between an occupational therapist and a physical therapist would be we look more at functional activities and include upper body strengthening, fine motor skills, anything that you need to complete those tasks of your daily living skills. Physical therapy will look more at your ambulation, your walking, your lower body exercises, endurance, things like that. In the morning when we get here, the occupational therapist will start a little earlier and we will meet the patients up in their rooms and we practice their morning routines with them. So this can be using compensatory strategies or adaptive equipment to get them independent and getting dressed and brushing their teeth and bathing and toileting. And then as the day progresses, we bring them downstairs to the therapy gyms where we may work on strengthening and conditioning. Again, anything that would help them get back to being independent. To be an occupational therapist, you have to have a master's degree. There is a licensing and certification requirement. When you finish your master's degree, you will take a board certified exam. This is a national exam, and then you're licensed per state. There are many prospects in advancement as an occupational therapist. There's different routes you can take. You can get your doctorate degree in occupational therapy, that'd be your OTD. From then you could be a professor of occupational therapy. You could do research, if that's the kind of thing that interests you.
I thought of a new neighborhood activity when we have our cookouts.
To make yourself a more desirable prospect as a high school student, you can do things like I did, where I started out shadowing occupational therapists in high school, just to make sure that that's really what I wanted to do and get a good idea. Then you can start volunteer work as soon as you get to college or even before. And then the more hours, the better it looks on your application. The thing I like best about being an occupational therapist is how rewarding it is. You really get to see patients come in at their lowest point, and before they leave here, they're so thankful for you. They're improved, they're independent now, they can go home to their lives. It's just a really rewarding job.